Hi, good afternoon, everyone. It's 2 o'clock, so I think we'll get started. So I'm Representative Corey Chan. I'm one of the co-conveners of the Kupuna Caucus, and I'd like to call this meeting to order. So first on our agenda, we're going to go over the poll results for the Kupuna Caucus legislative package. So I don't know if you can let's see. A second. Charles, are you going to bring that up or should I just read them off?
If you want me to put it on the screen, I can.
Oh, okay.
Shall I
Yeah.
put it on screen?
Yeah, can you do that for everybody?
Okay, hold on.
And then I'll just, so as you know, we had 28 proposals, and unfortunately, we can only um, take the top five. So these five are the ones that got the most votes out of all the members of the Kupuna Caucus. Okay. So these were the top five. First one was to establish a paid family and medical leave program. The second is establish a caregiver tax credit. And then you can see some of the summary over there. Then the third one was the raising the personal needs allowance for Medicaid recipients. The fourth one is funding the Healthy Hawaii Aging Partnership Program. And the fifth one is to fund the DOH's Kupuna Fall Prevention Campaign. So these were the top five vote getters for the Kupuna Caucus package. So just quickly, just want to go over the process from here. So these five ideas will then be drafted into bills. Then as soon as we get the bill drafts, we will share them with the caucus members at a future meeting or through communications, just so you all have a chance to review them. Uh, because the transition from ideas to actual bill, we want to make sure that everything that is covered in here is captured. And then just for all the other issues, because there were so many, were the issues that came up. Um, just because it's not a part of the Kupuna package doesn't mean that they're still not good ideas that could turn into legislation and be introduced in the next legislative session. So, if your issue was not on the top five and you'd like to still pursue it, please reach out to Charles with Senator Moriwaki's office. Uh, I don't know if you folks know this, but there's bill limits on the House side. So House, whereas the Senate, they don't have the same types of limits. So you are free to ask a member to introduce your bill. But I know Senator Moriwaki, she's going to be here. She's traveling, but hasn't, because she's one of the co-conveners, has asked that if anyone is interested to please reach out to her office to see if they can still have that bill introduced individually and not, even though it won't be on behalf of the caucus. But does anyone have any questions on that? See, I see a question in the chat. Um, wondering if more details on the funding, number 4 and 5. So I know for 4, Candy, for your question in the chat, uh, for number 4, there is a dollar in the suggestion, which is 600,000. For the 5th one, yeah, I'm not too sure what. I think it's budgeted at 100,000 per year, but I'll check on that. But I think those were the numbers for the funding. Question from Caroline.
Hi, Representative Chen. Caroline Cuddy Rao here with the Executive Office on Aging. I believe that amount for the Healthy Aging Partnership is derived from the operating costs to provide both the enhanced fitness and the Better Choices, Better Health, chronic disease self-management classes on an annual basis. So that's kind of the budgeted amount, because evidence-based programs are kind of costly, but they're scientifically proven to reduce or to increase people's health outcomes. So that's the amount. So I hope that helps.
Yeah, no. Yeah, thanks for that explanation.
Mhm.
Let's see, I have another question from Christina. Round up.
Aloha. Christina Valenzuela, also with the Executive Office on Aging. Just curious, will these top 5 legislative priorities that's going to be in the package be new bills that's going to be reintroduced for the session, or because it's a biennium, some of these bills, like the personal allowance and the paid family leave, were bills that were introduced in the last session. So I'm just curious, is it going to be new bills, or are we supporting those past bills as well?
So my understanding is that there'll be new bills.
Okay.
So these 5 will be then redrafted into new bills and introduced on behalf of the Kupuna Caucus as a new bill for the 2024 session. So there will still be, if these issues were on bills from the previous session, they will carry over, but then these will also be introduced as new bills. So they'd be starting from the beginning.
Okay, thank you.
Any other questions? Let's see. Okay, let's move on. So we have a presentation by Dr. Peterson on the 1115 demonstration waiver renewal. So, hi, Dr. Peterson. I'll let you
Hi.
take over and share.
I'm Dr. Moore Peterson. We're also, many people just call me Judy, so which is fine. I am the Medicaid director for the state, or the MedQuest administrator. I worked on a presentation. I realized I didn't send it to Charles, before the meeting. So I just sent it right now. Charles, I don't know. Are you able to pull it up, or would you like me to?
I can pull it up.
Okay.
Give me a sec.
All right. Thank you so much. And I apologize for not having done this ahead of time. I'm probably going to be using my own slides because I have the speaker notes, so I know how to cover everything. But I was asked to actually talk, if it's all right with you, I'll just do both, because I put both things into the same presentation, both topics. But I didn't put them in the order, apparently. That's in the agenda, so I do apologize for that. So is it all right with you that I cover both the section 1115 waiver update as well as the rate studies? I just put it in the opposite order as on the agenda. Is that okay with you?
Oh, yeah, that's fine.
Okay. All right. Thank you. Oh, that's good, because then now I don't have to.
Yeah.
flip everything around. I don't see the slides quite yet, so I'm assuming that Charles is still working on it.
Judy, did you send it to my email address? Because I don't see it.
I thought I did. Maybe it didn't hit send. Let me just double check. Well, I can try to pull it up myself. And then just
Either way.
my system is, it's like with so much going on, it's slowing down, and so that's why I was going, uh-oh. So I have everything closed except for this meeting. Hang on just a second. So sorry, this is taking so long here. Apologies for that. Oh, my system is not happy with me right now. Oh, there we go. I did send it to your email address just now. At least it says Charles Isimoto, but let me just double check what that address is. CIZUMOTO at capital.hawaii.gov.
Yeah, there should be a dot between C and my last name.
Yep, there is.
And I still don't.
You don't see it? Okay.
Yeah, maybe it's taking a while to go through.
My entire system is being incredibly slow, so I do apologize for that. Well, let me just go ahead and then I won't use my speaker notes, and we'll just assume that I can do this from memory and work from there. And let me just go ahead and try to share my screen if I can. Share screen. Let me know when folks can see it.
We can see it.
Okay. If people don't mind, I'm going to keep it not in presentation mode, just so that, and so you can get to see all the notes. And then hopefully it will eventually come through. Let me just start going through here. So I'm actually going to cover 3 different topics today, if my system will move along. But first, I wanted just to highlight who we are and what the MedQuest program is. So the MedQuest program is the Medicaid program for the state. And QUEST is actually an acronym. It stands for Quality Care, Universal Access, Efficient Utilization, and then Stabilizing Costs and Transforming Healthcare for our members. Our vision it's quite broad. It's actually the people of Hawaii embrace health and wellness. And one of the reasons I like to emphasize that is because our focus is not just on a targeted just for our population, even though just the Medicaid population, but we recognize that if we're able to advance and improve the health outcomes for the populations that we serve, it actually helps to raise everybody's health outcomes. So that's a major focus for us. And as always, we try to do everything by embracing these values of leadership, aloha, integrity, and then of course healthy outcomes, etc. And I just wanted to note that also that the top 2 pictures there are of people that we serve. There are members, our neighbors and friends and neighbors, etc. Currently, we serve about 1/3 of the state is on Medicaid, MedQuest, and that includes half the children in the state. So it's quite a large program, and probably larger than what many people are aware of. When it comes to the Medicaid program, we cover all the traditional healthcare services that any health insurance coverage would provide. But we also have some expanded benefits, including children's benefits called the Early Periodic Screening, Diagnosis, and Treatment, and non-traditional services like long-term care nursing facilities. That is actually a mandatory benefit, Medicaid benefit. There's also optional and waivered services that we can provide, and that's where the home and community-based services play a role. So home and community-based services are waivered. In other words, they're optional. We can choose to cover them, and then we have to ask for waivers in order to cover the home and community-based services. Whereas, in the original Social Security Act, Medicaid had the nursing facilities as nursing facility long-term care as a mandatory service. And so just a little bit more about home and community-based services in general and nursing facilities is that individuals, in order to receive these services, they have to meet a certain level of care. And that level of care has to do with needing significant assistance with various activities of daily living. And so we call that nursing facility level of care. So in order to get the home and community-based services, everybody has to meet that level of care. And then within the home and community-based services area, our focus is on trying to support individuals to live with as much autonomy and choice as possible, that the settings are actually required. It's a good idea, but it's actually also federally mandated that these settings be integrated into the community. People have to be able to have access to food and be able to lock their doors and et cetera. So those are the settings ideas here. And then we also want to make sure that all the services that we provide, but particularly in the area of long-term care and home and community-based services, that they're person-centered. They're around what that individual and that family wants, and what kind of quality of life and where it is that they want to live, et cetera. So I did all of that as a quick lead up into our Section 1115 demonstration renewal, which is happening right now. And so you might be asking, what is a Section 1115, a demonstration? And what it is that within the Social Security Act, Section 1115 gives the secretary the ability to waive most of these services, not all, but most. So it gives a broad authority, great amount of flexibility for lots of different kinds of Medicaid authorities, and in the types of services that we provide, the populations that we serve, et cetera. And these demonstration waivers have to be budget neutral, externally evaluated, and they of course have to be approved by CMS, which is our federal oversight body. So in our current Section 1115, we've actually had it since 1994. It gets renewed every 5 years. And going back to, I think it was in 2009 or so, the various different home and community-based service waivers that we had been covering using a different type of authority were all rolled up into our 1115. So today, within the Quest program that in the Department of Human Services, all of the home and community-based services are all incorporated into our 1115. And so currently, in our current waiver, there are 17 different types of home and community-based services. I'm actually not going to go through all of them, but I will just give you a flavor of these. So it's the adult day programs, assisted living facility, community care, foster family homes, counseling and training, environmental accessibility, adaptations, home delivered meals, home maintenance, moving assistance, personal assistance, personal emergency response systems. So you get the picture that there's lots of 17 different services that are all categorized under the home and community-based services, a bucket of services. I think it's fairly obvious. I don't think I have to go into this in too much depth, but the obvious reason we do that is to help people stay living in their, most people want to age at home or and live within the community, et cetera. And the way to do that is by providing these home and community-based services. And so we're looking at continuing those from the current waiver, and then we're looking at expanding some of these services in the upcoming renewal. We're in the renewal process right now. We just completed our 30-day public comment period. It ended November 16th. We're sifting through all of the comments. We received well over 100 comments on various different parts of our waiver renewal and application. And once we sort through and make any kind of necessary changes in order to respond to the public comments, we'll submit that to CMS, and then CMS will open up a public comment time period themselves once they deem the application to be complete, and then we go through about 6 months of back and forth and negotiations on what they're going to approve, what they're not going to approve, what's called the special terms and conditions. In other words, CMS, they don't just allow you to do this without any kind of response back. So we have a lot of reporting requirements that we'll have to do, or they'll say, oh, we'll give you this, but then you have to do all these other things in order to do that. So that's sort of like the timeline. This 6 months, our current waiver ends at July 31st of 2024. And so the new waiver, if all goes well, would start August 1 of 2024. So that's what we're talking about right now. I already covered very briefly about our current home and community-based services benefits. The one thing I didn't mention is that besides meeting the nursing facility level of care that I spoke about at the start, we also have a category, a population that we serve that's called at risk. In other words, they're at risk of becoming that nursing facility level of care. And so we do provide some, a subset of those longer list of services for these at-risk individuals to help allow them to stay at home for a longer period of time. So what we're going to be doing for proposed changes, we have 2 primary proposed changes. One is to expand the services available for the at-risk population to include assisted living facility services, because assisted living facilities, the way that they're designed is to allow people to live with minimal help, minimal assistance before they meet the nursing facility level of care, and then transition into that higher level of care as they either age or as they have greater needs, then they can transition to these higher level of care. But the starting off place is by definition, they don't meet the nursing facility level of care. And so in talking with the assisted living facilities, et cetera, this is something that we're going to include as an ask for CMS in our upcoming waiver renewal. And the other thing that we're going to be doing is expanding or continuing some of the flexibilities that we put in place during the pandemic, and we're going to be looking at how we can continue those. I have a separate slide on that. I'm not going to go through each thing in great detail, but I do want to call out that it does include continued flexibilities around the use of electronic signatures or telehealth for some of the processes, as well as permitting payment for services rendered by family caregivers or legally responsible adults or individuals. So that is something that was used quite a bit during the pandemic. In other words, family caregivers could provide some of these at-home services, personal care services, et cetera, with their appropriate training. And we're looking at how to be able to continue those flexibilities that we had started. Well, actually, we'd had it for quite some time, but they were formalized during the pandemic, and now we're going to formalize them into our waiver. Okay, so I'm going to pause there before I move on to the rate study work and just see if anybody has any questions, if that's okay.
Yeah. Anybody have any questions for Judy?
I know I'm talking really fast, so.
This is Alan Burdick. I have a question. I put it in the chat. It relates to adult death benefits for Medicaid recipients.
Adult what benefits?
Benefits.
I'm sorry, you're cutting out right in that. I hear adult and I hear benefits, but not the word in between.
So DENTAL, dental, teeth.
Okay, what about them and how relative to the waiver? What about them?
I'm sorry, not relating to the waiver.
Oh, okay. Well, if you don't mind, can I go through the
Sure.
presentations per the?
Absolutely no problem.
Okay. Thank you. All right. Are there any questions about what I presented so far? All right, then I will move along. So Senator Moriwaki also asked me to present on the home and community-based studies reimbursement the rate studies that we've been doing. And she asked me to present on those. And so I included not just the HCBS, but just calling out that during the last legislative session, the legislature did allocate money within our budget to increase the nursing facility rates. Additionally, they also finalized the nursing facility sustainability program, which also allows us to strengthen and increase the nursing facilities. And so, and just as an update on that, we've gone through a rate study. We've worked with the Nursing Facility Association, HAH. We're just in the process of submitting the necessary state plan changes to CMS in order to make these changes. They include revising the methodology as well as increasing the rates to bring the nursing facilities up to cost. They include incentives or increased payments for those nursing facilities that have higher nursing staff to resident ratios. It's been shown to be provide increased quality of care, et cetera. And so that's one way that we can help sustain that. So that is, there's actually also a way in which we're also, we have a pay for performance program and increased rates, as I noted here, for the higher nursing ratios. So that's where we are with that. So in the last couple of years, we've also engaged in a few rate studies that—
Judy, you have a question? Well, wait, she's talking about it now. Let her finish this. Okay, we'll let you finish first. Sorry.
Okay. All right. So we also completed a couple of rate studies for various different home and community-based services. We have completed them for various residential services like community care foster family homes, expanded adult residential care homes. We completed them for various in-home services, case management services, and the 2 adult day programs. We're completing a rate study also for assisted living facilities, and then what not related home care services. We have one other rate study that's going on. We did complete this study. This was actually part of a legislative report as well that we completed last year. We turned it in December of 2022, so it's a year old now. We hadn't completed the adult day program, so that's new this year. And so when the rate studies were completed, they looked at various things like wages, capital costs, cost of even vacation time, et cetera, benefits, and so to come up with an overarching rate to be paid. The actuaries helped us come up with various options. So you could have a low option, medium, or high, and for each of the categories, and then we presented that information to legislature last year, and we'll finalize the report on the adult day programs, and we'll turn that in this year. And so these are the results here, in that you can see how much would be needed to include that level of rate increase for these different services, whether it was at the low, medium, or high level. Last legislative session, there were a couple of bills that were introduced to help fund these. However, none of them were passed, and none of them were moved forward. We did include a request for the governor's supplemental budget as part of the executive admin package, and there will be in that budget request a request for $5.75 million of A funds, and 9.75 in federal funds to fund increases for these community residential services, like the community care foster family homes, expanded adult residential care homes, as well as for the adult day programs at the low level. So that's, you can do the math there and see what those programs are. I did want to also point out that there are other payments that go into payments for these community residential settings, because Medicaid does not for home and community-based services. These are for the services themselves, and they explicitly, we are not allowed to pay for room and board. So Medicaid is prohibited from paying for room and board for home community-based service settings. So those come from other payments from the individuals themselves. So as an example, the supplemental security income, SSI, goes towards paying the room and board portions of it. There's actually also a program called the State Supplemental Program. It's in statute as to what those amounts are. I had introduced it last time as one of the legislative priorities. Wasn't one of the top 5. Totally get it. It's fine. But I do want to point out that even if you don't have it as a priority, it is possible to increase both the personal needs amount up to from $50 up to $75, as well as to make some increases to the state supplemental payments up to a certain level without any additional general funds needing to be allocated, needing to be budgeted. It is within the current budget. It's not within the Medicaid budget because they're not Medicaid payments, but they're actually in the Social Services Division. that's where these state supplemental payments are. But they've been frozen in time since 2008, I believe. So over 14 years. And I put at the very bottom here of this particular slide, the bills where you can find the state supplemental payments, which is House Bill 1357 SD2, or House Bill 1309 HD1. They're not exactly the same bills. They're slightly different, but nonetheless, they seek to make the increases in the state supplemental payments. And then House Bill 916, in case you were interested, on the personal needs allowance, which is included in one of the top 5 priorities. That's where you can find, in the HD1 is where you can find the personal needs allowance increase. And I will pause there and see if anyone has any questions about the rate studies.
Questions for Judy? There was a question in the chat.
Yeah, asking to share the slide deck with us. Will you do
I
that,
will.
Judy?
Yeah,
Okay.
no, for sure I will. And I apologize. I did send it to Charles, but not till late. And
Oh,
yeah.
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 Okay.
And
I just received it a little while ago, and then I'll send it through the chat.
Right.
Thank you.
Thank you. And then I did want to know, and I apologize, I forgot who the representative was who did the research on a workforce. No, it wasn't representative, I apologize. But someone had done some research on other states and going, oh, look at all these great things. And I thought I just would want to mention that we too have this same plan. We have a home and community-based services financial plan. It's part of the American Rescue Plan. We realized that we didn't have it on our website, and so we're in the process of adding this to our website. But just as examples, that is why we're able to fund the rate studies, is that we're using these dollars from that initiative. There's overarching, there's more than 37 initiatives, very different initiatives. I've sort of called out a couple of them. Some of them are for increasing workforce and training programs for direct care workers. Several initiatives are really really working with the home and community-based service providers to help them have increased capacity to be able to work with individuals who have, highly challenging behavioral health needs, because many times those individuals are at higher risk of winding up in the hospital or unfortunately houseless because people don't have the capacity to be able to work with them, et cetera. So we have a lot of those initiatives across the continuum, but including within the home and community-based services workforce and area. And so with that, that's the last of the slides, I think. Yeah, that's it. And so I can stop sharing. I think I can stop sharing. So oh, stop sharing. There we go. Sorry. Got myself into it and now I can't get myself back out. All right. And then I think someone had a dental question, but I don't know if that's related to the Kupuna Caucus. So
Donald, do you have a question for Judy?
Yeah, thank you, Corey. Can you hear me?
Yes.
Judy, thank you for your presentation. Donald Sakamura. I'm with Citizens for a Fair American with Disability Act, right? I deal with public transportation, Oahu bus and paratransit handyvan. My question is concerning neighbor islands. If you have these daycare programs, how will you get the transportation to them in rural areas where there is no transportation that's affordable or on time? Do you have an agency that you use to transport these individuals back and forth to daycare or medical appointments?
We do not have a agency per se, but there are some public transportation. There's actually also we can use various different transportation options for people with disabilities. There's different vans. We can use taxis. We can use various different things that help individuals get from one place to another.
I understand that there was in Oregon, there was a TriMet program with county, state, and federal money. Would that be involved in this situation with Hawaii?
TriMet would not be involved here. Are you asking, do we partner with the local county here?
Counties, like outside counties like that, if they have transportation needs, do you folks do that for the clients?
We provide transportation for all our members when they have non-emergency medical transportation needs, regardless of what island they're on. The program does not look like the one in Oregon, because the one in Oregon we don't have an equivalent TriMet organization, and in fact that one has also changed over time. So it doesn't operate the same way that it did when I was there, and I was their Medicaid director.
Okay, is the company that you're using, is it Logistic Care, or what is the company that you folks, United Healthcare, you folks use?
Well, we have five different health plans, and each of them provides the non-emergency medical transportation differently. They either subcontract it out with a company such as Logistic Care. Others do that operation themselves, and they make their own arrangements. HMSA does that. So, and there's several different companies that are in existence that do this. And they themselves also have contracts or the managed care plans. They can make arrangements with handyman, etc.
Okay, how about neighbor islands? Have you seen any increase or demand for the transportation in rural areas? This is so big, like Big Island and other areas of Maui and Kauai.
Have we seen an increase since when, or from at a particular point? Are you asking
for transportation, just to get to their daycare in rural areas of say, for instance, the Big Island, you got Kona and Hilo with a 9-mile radius for public transportation. But do you have anything in rural areas where people can go to daycare from far away?
We have transportation. Transportation is available for all members, regardless of their island, regardless of the remote aspect of it. It is arranged by the health plans, because the health plans are the ones who operate all of our programs. We contract with them to provide all services, including the adult day programs. They're the ones with the contracts. They're the ones who are also responsible for providing and arranging for transportation needs when that's needed. And I am not aware of any increase or decrease when it comes to the request for transportation to any service, whether it's adult day programs or doctor's visits, etc.
Okay. I just wanted to know if there was any data backup on that, how your plans are going for transportation, moving people around. Thank you.
We do get reports from them, but it's not at that level of detail of as far as necessarily what the services are for, et cetera. It's on the transportation.
Okay, thank you.
Mm-hmm.
Okay, so I also see Rick has his hand up.
Okay. All right. So my famous question 7 years into this, Judy, how about hearing aids? Any coverage for that scene? It's now or in the future? You and I talked briefly, but we've never had a chance to sit down and talk it through.
Hearing aids are a current covered benefit, and they have been for many, many years.
Yeah. So my cousin actually got a pair of hearing aids. It cost $9,700, and the coverage was $700. They're not well covered. So that's the issue.
All I'm saying is that hearing aids are covered, and that your person should not have been paying $9,000.
No,
right?
it shouldn't have been.
Okay. Right. And they if they have Medicaid coverage, they should not have been billed.
Okay,
It
thank
should
you.
have been free because it's a covered benefit.
Okay.
Yeah.
And I also see Ellen. Ellen, you have a question? And then after that, John.
Thank you very much. Ms. Peterson, notwithstanding your impression, the Legislative Kupuna Caucus has as item number 11 for bills to support, require MedQuest/DHS to report yearly to the legislature and public on data relating to the 25.8 million released to MedQuest division in 2022 for adult dental benefits. So, yeah, it is within the scope of what Legislative Kupuna Caucus wants to do. So I would appreciate a brief report from you on where we are from something that should have, that, legislature gave an effective date of July 1 of last year.
And we certainly did implement it. We implemented it in January 1. I do appreciate the fact that you did turn in that in for the request. I can't provide obviously that information today. When I was saying that it wasn't on the Kupuna Caucus, I meant it wasn't on the top 5, and it wasn't what I was being asked to speak to today. If the Kupuna Caucus would like me to come back and present on this topic in the future, I'm happy to do so.
So you have no answer for us today. You can't give us a brief summary of whether the benefit is out there, whether you have, for example,
as I just noted, we implemented it in January 1 of this year.
But what do you mean by implemented?
It's out there, it's being provided, people are getting care.
Has notice been given to adult Medicaid recipients that this benefit has been restored?
Yes, it has.
By what?
We've included it in several notifications, and it's been sent. And every single member received a member handbook that included very explicitly the adult dental is included. So yes, we have. And we did that earlier this year.
All right, I'll have to take a look at the handbook. Thank you.
All right, thank you. John.
Aloha. Looks like Alan and I are sitting on the same beach there. So Judy, thank you so much for being willing to talk to us. My question is again regarding the community care family foster homes and the expanded adult residential care homes. So those folks are taking care of people who should be in a nursing home because they're skilled nursing or they're intermediate care nursing. And in a nursing home, we're talking $15,000 a month, which I realize Medicaid doesn't pay that amount, but that's what the facilities are charging. And so in August of 2023, we did a count, and we have 3,158 community care family foster beds. One of those people can be private pay, the other 2 are Medicaid. So roughly, we're saying maybe 2,000 of those people are on Medicaid. And then the expanded arches, type 1, 5 beds or less, we have 1,268 beds. And with the type 2, we have 602. So you total all those people who could be in a nursing home, and we're talking quite a bit of money. So the foster homes and the expanded care homes really do save the state a lot of money. And so I'm wondering, can DHS work with these people to come up with some kind of an increase that everybody would think is fair? Because water's about to go up, property taxes have gone up, everybody knows that food has gone up, our gasoline has gone up. And there's never been any kind of a minimum cost of living adjustment.
That is precisely why we did those rate studies. That's precisely why we had that report. We sent it into the legislature last year. We provided that information where we've included the the possibilities of doing the rate increase in the supplemental budget. That's exactly why we're doing this. It's for those. That's what those community residential things were. When you see the slide deck, you'll see there, and we have a much longer report that is also available. It's actually on our website. It's in the legislative report where you can read about all the wage studies, the looking at projected increases, making sure that we could account for when their employees needed to take vacation and time off and benefits, et cetera, and increasing their benefits so that they could be covered. So we are, and that is why we did the rate studies. We did put forward that information, and happy to have more conversations about it. But we did extensive work on that for that very reason.
Well, I took a look at the slide in your PowerPoint right now, and I couldn't see where it actually gives the dollar amount. How much are you proposing to give them as an increase?
It's that is in the larger report, but the actual larger report takes those dollar amounts and says, okay, for this service, for the low, it's this much of an increase. For the medium, it's this much of an increase. And for the high, it's another %. So that's in the full legislative report. I'm happy to send that to you if you would like it.
I think we would all like it. Thank you.
Yeah, it's out there on the legislative, on the out in the world, on the legislative reports world, but we can forward it again to this committee and this group. I do want to point out that, again, I'm just going to emphasize once again that Medicaid does not pay room and board. And so that if you want to think about what the total payments are that go to the community care foster family homes and the E-arches, it includes both the home and community services payments that Medicaid makes, as well as the SSI payment and the state supplemental payments that cover that room and board portion. And the room and board portion, that state supplemental payment, that is in the legislature's control today to increase those amounts. That would also help tremendously those facilities, and it would not require any additional dollars within the amounts that we've actually provided that amount as well, and we're happy to provide that information again if that's helpful.
Yes, well, my main concern is that if there's not an increase, we will see more of these homes go out of business. And if a caregiver does not have that one private pay person to kind of float their boat, then they're really, really struggling. And we do not have enough nursing home beds to put all these people in a nursing home. So I really think this needs to be addressed as quickly as possible. Thank you.
In this case, you're preaching to the choir.
Thank you. So I want to respect everyone's time because the hour is almost up. So if you still have a question that hasn't been asked, please reach out to myself or Senator Moriwaki's office, and we'll get your question in touch with Judy, and she'll be happy to answer it. Is that okay, Judy?
Yep.
Okay.
Happy to.
So I'd like to move on to the next item on our agenda. It's the Council of State Governments Long-Term Care Workforce Development Technical Assistance. It's by Dr. Balaz.
Hi, everybody. It's nice to see everyone and to be part of this discussion. So really, it's not going to be a presentation, but more of an ask. The CSG met, and we are definitely taking a look and trying to work on the challenges that the direct care workforce is facing, as well as to bring and propose solutions for us here in the state of Hawaii. And so what we would like to ask this group, and for anybody that you know, an organization, an individual, is that as as the committee, has come together to identify challenges and propose solutions, we would like to conduct a focus group comprised primarily at this time of the CNAs and LPNs who are currently in the field or who have recently left the field, especially during the pandemic. And this focus group would also assist the task force in identifying challenges and incorporating their solutions in our strategic initiatives to address the concerns of the workforce. We really want to hear from those who are in the workforce or who have just recently been in the workforce. Definitely want to hear from you. If it is any of you out there who is joining us right now, we would like to hear from your workforce or just anyone that you know. So if everyone joining the call today can think of one person from your organization that may be interested in joining the group, you can email me and I'll put my email in the chat, or we can send it out. And tentatively hoping to meet later this month, either the 21st, the 22nd, or the week of the 27th, the time to be announced, depending on what room that we can get at the Capitol to meet. But if you are interested as an individual, or if you are interested as an organization, please email me and reach out. We really want to hear from the people who are on the ground. We want to hear their voices. We want to make sure that what we are doing is aligning with their needs so that we can continue to improve the quality of work and work-life balance here in Hawaii and for our direct care workforce. And so I will add my email in the chat, and I hope to hear from all of you guys soon.
Thank you. Any questions, members? Don't see anything, but Dr. Velez did put her email in the chat, so please feel free to reach out to her. So I'm going to move on to announcements. Our next meeting will be January 5th. And then please, if any of you have topics for future Kupuna Caucus meeting topics, please reach out to myself or Charles at Senator Moriwaki's office. Donald, you have your hand up? Yeah, you have a question?
Yes, Corey, can I make a request to see if I can get the documents accessible since I'm blind vision impaired? Judy's one, and anything that was put in the chat for email to my email account, if Charles can do that for me.
Okay.
Yeah, I
Thank
can
you.
do that.
Yeah, and happy holidays to you and everybody.
Yeah, happy holidays. So we have any closing comments from anybody? Thank you so much for coming and joining us this afternoon. That's a Friday afternoon. But with that, I'll adjourn the meeting right before 3.
You know, I'd welcome you, Corey, to your new role. So thank you for leading the meeting. And nobody had a chance to say that, but welcome. Appreciate it.
Thanks.
Thank you, Corey. Have a good holiday, everybody. Holiday season. Thank you.
All right.
Happy holidays.
Happy holidays.